An enlarged prostate, also known as benign prostatic hyperplasia, BPH, is a common condition that affects many men as they age. While it's not cancerous, it can cause various uncomfortable symptoms that can impact daily life. So, recognizing these signs early can help manage the condition better. Here in this video, we will tell some of the important signs and symptoms of an enlarged prostate. Make sure you subscribe to our channel and press the bell icon to get regular updates. Let's get started. Number 10. Frequent urination. Frequent urination is often one of the first signs that a man might have an enlarged prostate. This condition, also known as benign prostatic hyperplasia, BPH, causes men to feel the need to urinate much more frequently than before. The situation can be particularly bothersome at night when it leads to a condition called nocturia, where the person wakes up several times just to relieve themselves. The frequent urge to urinate happens because the prostate gland, which surrounds the urethra, becomes enlarged and starts pressing on it. This pressure makes it harder for urine to pass through, and as a result, the bladder doesn't empty properly during urination. Since the bladder still holds some urine, the person may feel the need to go again soon after, which can be very inconvenient. Over time, this constant waking up at night can cause fatigue from the loss of sleep, and during the day, it may become frustrating to frequently seek a restroom, disrupting daily activities. Number 9. Urgency to urinate. Many men with an enlarged prostate also experience a sudden and strong urge to urinate. This symptom can be overwhelming and can happen even when the bladder is not full. The pressure from the enlarged prostate on the urethra creates a strong sensation to urinate, and often, the urgency comes with little warning, making it difficult to hold urine for long periods. This sudden need to urinate can be particularly distressing in public settings or during important tasks when finding a restroom quickly might not be easy. Some men may become anxious about the possibility of not making it to the bathroom in time, which can be embarrassing. This urgency to urinate can disrupt daily life and cause worry about when the next episode will occur. Number 8. Weak urine stream. Another sign of an enlarged prostate is a weak or slow urine stream. Normally, urination happens with a steady, strong flow. However, with an enlarged prostate, the urethra becomes compressed, which restricts the passage of urine. This causes the flow to slow down or become weaker. Men may notice that it takes longer to fully empty their bladder, and the stream may start strong but quickly lose power. In some cases, the urine flow may stop and start, creating an irregular stream that makes urinating feel like a drawn-out, frustrating process. This weakening of the urine stream is often one of the clearer signs of BPH, as it directly impacts the ability to urinate with ease, making daily bathroom routines more challenging. Number 7. Difficulty starting. Urination. Men who suffer from an enlarged prostate often experience difficulty when it comes to starting urination. Even though they may have a strong urge to go, they find it challenging to begin the process. This issue, referred to as hesitancy, arises because the prostate, which has become enlarged, puts pressure on the urethra. The urethra is the tube through which urine exits the body, and when it becomes narrowed due to the prostate's growth, the muscles in the bladder must work much harder to push the urine out. This extra effort causes a delay before urination can begin, which can be frustrating and uncomfortable for men who experience it frequently. The feeling of needing to urinate but having to wait several seconds or more for the body to respond can add additional stress to managing this condition. Over time, this problem can worsen and make daily life more difficult. Number 6. Incomplete bladder emptying. Another common issue men face with an enlarged prostate is the sensation that their bladder hasn't fully emptied after urination. This feeling of incomplete bladder emptying happens because the enlarged prostate continues to press against the urethra, preventing all the urine from flowing out during a trip to the bathroom. As a result, some urine is left behind in the bladder, and this leads to the sensation of still needing to go even though the person has just finished urinating. This symptom can be particularly bothersome because it forces men to make frequent trips to the bathroom, and the discomfort of feeling like the bladder is still full can linger throughout the day. Over time, this incomplete emptying can lead to further complications, such as urinary tract infections, UTIs. The leftover urine in the bladder provides a breeding ground for bacteria, increasing the risk of infections and causing more health concerns in addition to the symptoms of BPH. Number 5. Dribbling after urination. Men with BPH may also experience dribbling of urine after they think they've finished urinating. Even after trying to empty the bladder fully, small amounts of urine may continue to leak out. This occurs because the enlarged prostate makes it harder to fully control the flow of urine, causing it to drip out slowly after the mainstream has stopped. Dribbling can be both inconvenient and embarrassing, as it may result in wet spots on clothing. It can also make men feel like they haven't finished urinating, adding to the frustration caused by other symptoms such as frequent urination and incomplete bladder emptying. Dribbling is often a sign that the prostate's growth is affecting the ability of the bladder muscles to fully stop the flow of urine. Number 4. Pain or discomfort during urination. Pain or discomfort during urination can be a troubling symptom of an enlarged prostate. As the prostate enlarges, it begins to press on the urethra, the tube that carries urine from the bladder out of the body. This extra pressure makes urination more difficult and can result in a burning or stinging sensation as the urine passes through the narrow opening. Some men also experience a general discomfort in the lower abdomen or the pelvic area when they attempt to urinate. The level of pain can vary from mild to severe, depending on how much the prostate affects the urinary tract. While pain during urination isn't as common as other symptoms, it's still important to pay attention to it. This pain might also signal other issues, such as a urinary tract infection or complications caused by the enlarged prostate. Seeking medical advice is always a good idea to ensure that no further issues develop. Number 3. Blood in the urine. Another symptom that might arise, though less frequently, is blood in the urine, a condition known as hematuria. While it can be frightening to see blood in the urine, it can happen due to the prostate pressing on the urethra and bladder. This pressure can cause small blood vessels in the urinary tract to burst, leading to blood being released into the urine. The blood may appear as a pink, red, or even brownish tint in the urine. Even though this symptom can be concerning, it's important to remember that in most cases related to an enlarged prostate, it's not usually something severe. However, blood in the urine should not be ignored, as it could be a sign of other serious conditions like kidney stones, urinary tract infections, or bladder cancer. Therefore, it's essential to get it checked by a healthcare provider to rule out more serious causes. Although it's not typically dangerous, it's always better to ensure that everything is under control. Number 2. Straining to urinate. When the prostate grows, it obstructs the normal flow of urine, making it harder for the bladder to expel urine naturally. This forces men to strain or push harder to begin or maintain a steady stream of urine. This extra effort can be exhausting and uncomfortable, as it requires the muscles in the pelvic area to work much harder than they should. Over time, this strain can lead to additional complications, such as hemorrhoids, because of the increased pressure. Furthermore, as the bladder muscles continue to work harder, they can weaken over time, making it even more difficult to urinate properly. This can turn daily bathroom visits into a lengthy and tiring process. For those experiencing this symptom, getting medical advice can help manage and ease the situation before it worsens. Number 1. Urinary tract infections, UTIs. Men with an enlarged prostate are at a higher risk of developing urinary tract infections, UTIs. This happens because the bladder does not fully empty, leaving behind urine that can become a breeding ground for bacteria. UTIs can cause additional symptoms such as a burning sensation during urination, cloudy or foul-smelling urine, fever, and general discomfort in the pelvic area. While UTIs are more commonly associated with women, men with BPH are vulnerable to these infections because of the way the condition affects the urinary system. Frequent UTIs can be a sign that the prostate has grown to the point where it is significantly impacting bladder function, and medical treatment may be needed to address the issue. In severe cases, repeated infections can lead to more serious problems like kidney damage if not treated promptly. BPH is progressing, and needs medical attention to prevent further complications. That's all for now. I hope you have found the video informative. If you have any questions, let us know in the comment section. Like and share the video and follow us for more amazing content. Thank you.